One of the byproducts of the pandemic over the last 2 years has been an increase in deferred health maintenance. This deferred care can take many forms, from childhood vaccinations and general physicals to delayed operations or cancer screenings. Each instance of deferred care can have a profound effect on that individual. A breakthrough case of a deadly vaccine preventable disease in a child, or prolonged untreated high blood pressure that leads to a stroke or a heart attack. A hernia that turns from a simple procedure to a major emergency surgery. Or a colon cancer or breast cancer that, when found early, may be manageable, but when delayed, is anything but. Delayed medical care has been a critical issue nationally as well as locally. A study was published just last week. I shared the details on Twitter, but they found that 27% of people reported delaying their medical care during the pandemic. Importantly, those numbers trended higher for those with poorer health status, and those with worsened mental health conditions, and those with lower income. In short, our more vulnerable populations were more likely to delay medical care. Equity matters. Access matters. And at these levels, delayed care will impact not only the individual, but the community. With increased disease burdens from heart disease, from strokes, and from cancer, as well as increased health system access downstream, where problems are exacerbated rather than upstream when they're preventable. This is a crisis within the crisis, but the data presents an opportunity for targeted interventions to ensure equity in access to care, and particularly equity in the ability of our most vulnerable to catch up on healthcare that was missed over the last 2 years.